Okay, I'm happy to respond to a few questions before I go home and get some rest. But I have to tell you now, I do not have any solutions, okay? My mouth is not a prayer book. I don't have a window onto the answer. But I'm happy to try to have a colloquy with people and respond to any questions that you might want to put to me.
So I know within the drug policy movement, there's lots of talk about using the economic recession that we're going through right now as like a catalyst to reform drug policy in the sense that like we spend less money on incarcerating people and also maybe be tax regulated or things along those natures. But I also see economic incentives for people to do it the other way in terms of like indicators. Like every time you take somebody out of prison, they're now on the unemployed list rather than in prison.
Yeah.
And obviously,
and you're saying, therefore, you might want to keep them in prison so the unemployment rate doesn't go up?
I mean, not me.
I mean, therefore, a state official or a federal official might favor incarceration as a way of disguising that their economic policy isn't working for the people?
Yeah.
Okay.
That's
rather conspiratorial of you to think that.
So, like, how do you see this affecting the drug policy movement, specifically maybe with the politically relevant Rhode Island decrim bill that's currently like being processed through the chambers?
Oh, I don't know. I'm not sure exactly how that might. What do you think?
It definitely gives the drug policy movement something to get hyped up about, and it gives us a catalyst. And if we're pushing for it, then like we can definitely, I think it can be framed a certain way.
Well, let me ask you guys a question then, since I've been provoked here. So there's this thing, you know, hyper-incarceration, mass incarceration. As we've seen, it's largely a phenomenon of the poor, the minority, male. It doesn't really intersect our lives that much. One or two of us in this room, maybe if you're very unlucky and very stupid, okay, could end up in the slammer, but unlikely it's not going to happen. Drug policy, though, that's intersecting our lives every day, right? Because because it's criminalizing something that we might, I mean, or might not. I'm not saying, you know, might or might not elect to do, right? Which we might feel like we have the right to be able to elect to do. Frankly, I'll tell you, that's my feeling, not my action. My feeling is I should be able to do that if that's something that I wanted to do. I mean, I'm not hurting anybody by doing that, growing something in my yard and then smoking it. What's wrong with that? I mean, you know, I would say that would be my personal thing. The question I want to put to you is, how do those things intersect? In other words, I'm sorry, are you guys just a bunch of privileged white kids who want to get high and know you're never going to go to jail? Or does the kind of libertarian thing about get off my back and let me live my life ever intersect with the other thing, which is there's this mobilization of domestically applied force to the least advantaged people in our society, which is a substitute for constructive social policy, and which has thrown, you know, hundreds of thousands into the slammer. Do those things intersect with each other? Or are they like on parallel tracks? Just ask.
Well, if they didn't intersect, we wouldn't be here, right?
Okay. I accept that. You are here and you're smiling. You know, so you care. And I didn't mean to suggest that you didn't. But what are you going to do? Is the question. Sorry?
We're working really hard on passing the Rhode Island decrim laws.
Okay. I'm all for it. How can I help?
You can join a panel that's going to analyze and decide whether or not the decrim will be effective in Rhode Island.
Is there going to be such a panel?
Were you already on that panel?
Oh, that panel. I didn't make all the meetings, but I did see the report and I signed off on it. No. That was about marijuana, and we did recommend decriminalization. That's what our report said. That was an advisory to the Rhode Island State Senate. You know, yeah. Is there anything else I can do?
You can call your representative.
All right. I vote in Massachusetts, sadly. But,
Speaking for you personally, I think you're already doing what you need to be doing.
thank you very much. I appreciate it. Thanks.
The most effective thing someone in your position could be doing is going out and talking to all of us who are going to go on and maybe make policy or,
Yeah.
you know, maybe worst case scenario, become a police officer. Who knows?
I mean, I think even on like worse there isn't really a worst case scenario because we'll all do something, and most of us will probably vote or at least pretend to when we call our senators and say something.
Yeah.
So in educating people, even if they don't necessarily go on to make policy, like you said, a grassroots social movement is what's important. So the more people like you who can be very like charismatic and have the data and the research that you've done and the information can go out and spread that, so that hopefully and eventually enough people hear what's going on and find out that it is more than, or at least that it might be just more than some privileged white kids wanting to get high, and maybe realize that whatever they feel, a change does need to happen, and eventually we will have enough numbers to have the 10,000 people in front of the State House.